I guess it's recording, right? Hold on. Yes. Okay, hello everyone. This is our last training session for SBRT and SRT. Sorry that if you come here early because our time zone has been different. Right now is US Central Time, 8:04 a.m. So apparently if you came here this morning at 7 o'clock Central Time, you missed last session. We had the same problem because of the time changed. Our time because of the daylight saving, although many countries do not have winter time, so that's the reason why it causes confusion. Okay, so let me share my screen. Again, this is the training number 6, sorry. And in the last few weeks, we have talked about, our physician, the medical physicists have given several lectures about the basic aspect of different disease sites, including the brain, lung, liver, prostate, bone mass, and pancreas, and also cervical cancer. So today, one of our dosimetrists and myself will give a training on planning demo. Let's see if any chat message. Okay. Again, so please go ahead to register for this training session. If you join 5 of our 6 training sessions, you will receive a certificate. Geneva will contact you, and so please go ahead to register through the Google link. So let me see. Let me type the Google link again. Geneva can actually copy and paste over there. Yeah, if you have a question, feel free to type in the chat. So I'm going to give the training, but I will still keep watching the chat message. Is Tram here? Tram is our dosimetrist. She received training from Emmett Anderson a few years ago, and he worked with us as dosimetrist. Tram, are you here? She texted me he had some audio problem. So, Tram, you ready? Tram, you want to get started?
Can everyone hear me?
Yes, now I can. Okay, maybe you can get started. Then I will also, Tram will give some demo of the planning for 2 disease sites. One is lung, one is liver. Maybe you can start with the liver first. And then I will give probably 1 or 2 cases for the brain, because brain radiosurgery or SBRT are a little bit different. So we're going to do the training until 9:30. So Tram, go ahead.
Okay. Can you all see my screen?
Yes.
Okay. So usually I have a few contours before I start planning. So we will go ahead and go to the contouring tab. Okay, so here we have the PTV and ITV, and I will create rings first. So the first ring, let me see, and this is the body. 1 second.
So Tram is trying to create some optimization structures.
So the first ring, we want 1 millimeter margin away from PTV to avoid conflicting objective. I will start like this. Okay. And And the first ring, I make sure that all the structure is also in high res. Okay, in the first ring, we usually want a max dose of around 90%. Then we go ahead and make the second ring here. Okay, so it's from 0.6 to 1.3. And the third ring. Okay. So we have all our rings in. Next will be the ITV and PTV. For the op PTV, I will subtract out the ITV. And the ITV, I will give it an inner margin of 0.1. Because it's very, it's not a lot of space in between. So if I crop the ITV as is, it will not be, how you say it will not be a solid structure. The ITV.
So there are many different ways to create optimization structures really based on your experience. And this is Pam is sharing her experience. Overall the goal for this ring structure is make the planning, the dose is more conformal to the target, because that's very important for SBRT or SRS. The dose fall has to be very sharp. Yeah.
Okay. So again, for the ring 1, we want to restrict mass dose to 90%, and ring 2 around 50%, and ring 3 25 to 30%. So we want to, the goal again is to have a rapid dose fall off. And here we have all the critical structure, including core, spinal cord, lung, yes, ribs, and what else? Okay. And we will do our planning on the average scan. I think I'm good for now. Let's see. And body.
So we also mentioned that in our previous lectures, usually, actually it's kind of very important to have the 40 CT to for the planning. So 40 CT, that's actually the ITV is defined from the 40 CT, and Tran mentioned that she's making planning on average CT, because when you take the cone beam, you want your planning CT match with cone beam. Cone beam basically take quite probably 1-2 minutes for like the true beam. That's the reason why we use the average scan.
Okay. And then we'll insert a new plan from template. Okay.
So you can see that Tran actually used the Halcyon machine. I know we have Nika Income from Guatemala. You have Halcyon machine, which actually Halcyon machine is very good for stereotactic body radiosurgery without couch kicks. Yeah. And then you can also use the true beam. Later on, when I give the demo, I will use the true beam on the edge. Tran, you want to actually also briefly mention that what is the dose and what's the objective for this plan. I believe we treat all liver with 5 fraction. Total dose is 50 gray. Yeah.
Okay.
Can you go dose objective?
So then next thing I will do at this point is to make sure that the user origin is set. Okay, so it is set at BB. And then we'll place the isocenter in the center of PTV.
Mhm.
And then I'll make sure that the shift is fine. Okay, or round it up a little bit. And since it's a Halcyon machine, the only energy we have is 6x FFF. And we want to use flattening filter free to take advantage of the high dose rate and decrease treatment time. Okay.
So you have 2 full arcs, that's right?
Yes, currently
okay.
2 full arcs.
Okay.
But since it's only on the more on the right side, I will do partial instead. So going from maybe 35.
Mm-hmm.
And I'm okay with the collimation angle here. And we don't need any couch kick. Or we can't do it anyway for the Halcyon. Okay.
Actually, for like a body site like lung or liver, and that paper actually we published that couch kicks which really does not help much. Maybe slightly more conformal, however, it cause more issues about the collision, right? So maybe 5 degree, if you want to use your true beam, 5 to 10 degree would be okay. If more than excuse me, if more than 5 or 10 degree couch kicks will cause a problem because of collision, yeah. So you can see Tram actually, she's not using the full arcs because the target is on the right side. That's the reason why she applied for the template, but she modified the arc angles. So,
Okay. And the collimation angle this can be 10 and 350, depending on the shape of the target, and I'm okay with that. Again, we choose the beams and the arc, the angle that enable the leaf travel that limit the excess dose to the normal tissue. Then I would just play this real quick to evaluate the jaw setting and everything else, and check the MOC motion. Okay. So our prescription is 1,000 times 5 fraction. Then we will change the technique to SRS art therapy. Because we're gonna have higher MU in this case. So by changing the technique to SRS art therapy, we increase the MU cap. Okay. So at this point, I will go to the optimization.
you can see actually Tram is using only 2 partial arcs because the target is very regular shape, right? And sometimes we have to use even 3 or 4 arcs to get more conform. But in this case, the target shape is quite simple.
And for Halcyon, we don't have to worry about chart tracking or check this off. Okay. Then so for the PTV, we want 100 and around 101% for the min dose or the lower objective. Would be fine. And for the upper, around 10%. For the ITV, the lower objective around 115 of 5,000. And then here for the upper objective of ITV, in the prescription, we want max dose of no more than 130. So I put around maybe 127%. That would be 6350. Okay. And priority.
So this optimization, the first structure is basically PTV minus ITV. That's right.
Yes.
Okay. Right.
Okay. And for priority, I use 100 for target, and starting out maybe 50% of that for all the ring structures or OARs. If the lesion is far away from the normal organ, then I might go low on priorities. Okay, so again, ring 1, 90% will be around 4,500. And 50% of 5,000.
So TRAM is trying to create this kind of gradient, the dose fall gradient.
And ring 3, around 25% of prescription dose. Okay. And here I make sure that all the setting is good there. And we have the normal tissue objective here. I like to do it manual around, maybe around 75 as a priority. Okay. And the NTO is playing the crucial role in optimizing rapid art plan. Okay, and we have the PTV border to start around 0.1. The start dose. And dose around 50. And the fall off 0.4. Okay. So it is taking care of things like lower isodose line that's outside of PTV, and the shave lower isodose line for like a rapid fall off after the PTV.
Yeah, so basically, this normal tissue objective is quite useful. What she is doing right now is from 1 millimeter of away from target, the dose fall from 100 to 50% within, I think, 0.4 centimeter, I guess, right? Yeah.
Yes. Let me see the dose follow or the strength, the strength of the dose decrease.
Okay.
Is right here, and the start dose or the upper constraint that we shouldn't exceed, and then the end dose or the minimum dose constraint that accepted outside the PTV, and yeah, that's about it. Okay, so we do want a hot spot inside the PTV at the center. Okay, and the more we allow the hotspot to be inside the PTV, we can push on the NTO and ring to get tight and fast dose fall off outside of our target. And at this point, I can start.
Do you need some objective for the ITV and the PTV, or you just use the ring structure to control those?
Can you repeat that?
Yeah, so do you need an objective for ITV or PTV?
The objective, so 101%.
Okay,
and
that's the
10%.
PTV, right? Okay.
Yeah, and then here,
Okay.
on the prescription, we don't want anything more than 130%. So I have around 127 at this time
Okay.
for the ITV.
So I would say, this plan is really not much different from regular VMAT plan. For the regular VMAT plan, you still need, conformality, right? But this one, you just probably have better control of the dose fall away from PTV using different ring structure. That is basic idea.
Mhm. So I'll let this run through level 2 and then I'll pause. Yeah, if we are away from sensitive OERs, then I usually allow it to get like a really high hotspot. Unless it is overlapping with PTV or nearby the PTV, then I will restrict it a little more. Okay.
Okay, while we are doing the optimization, any question from the audience? Probably many of you wrote down a similar plan, but just give them for different disease site and show how we planned in this case. This case is relatively easy, to be honest.
Yeah. So the process is very similar to a regular VMAT at this point.
And I also want to mention that the margin from ITV to PTV, I believe this case usually is about 5 millimeter. And the ITV is drawn from the 40 CT.
Okay, so I will stop at level 2 to evaluate plan to see if we need to add any OARs here. Okay, yeah, I forgot to add in the clinical goal. From the look of it, it should be okay. Maybe I'll fast forward a little bit. So for SBRT plan, we do not want to push too much on OARs as we don't want any dose streaking. So our main goal is conformality. So by pushing OAR, it's affecting our dose distribution. So unless it's really necessary or is it just overlapping with our target.
The optimization of those calculations for SBRT usually takes longer. The reason that it's a high resolution, right? We're using a 1.2 millimeter resolution and so many grid, so many voxels to calculate or to optimize. That's the reason why it takes longer, even though we are using the GPU, right? Yeah. So
yes. So usually at level 3, I'll make sure we meet all of our constraint or pushing hard on the ring.
yeah, you can see on the right side the ring structure, what's called that the weight for optimization cost function. Sorry, you can see actually they're pushing very hard about different ring structures, right? PTV, which means the optimizer is working hard on the conformality.
And it's okay, we see a little bit of a shoulder curve here. We're gonna renormalize the whole plan later. So at our clinic, we usually want the at least 100% of the prescription to 90% of the volume or better. And then we will evaluate the hotspot, min dose to PTV at least 90% of prescription.
why it takes quite a while. Okay. This is calculating intermediate dose. So the question, what's your MLC margins for planning?
It is 0.5.
Okay. This is the margins actually expansion from ITV to PTV. I would say the margin is sort of PTV margin, not MSF, not MLC margin. Yeah. So the plan you can see actually, it's quite conformal.
And while I'm here, I'm evaluating the 50% isodose line. Make sure it's not outside of this 2 cm ring.
Yeah, we mentioned that how we're going to evaluate the conformality plan. For this kind of plan, usually we want to have 50% of isodose line, a lot of passing through 2 cm expansion of the PTV.
Taking much longer than usual.
Yeah, for next case, probably we can quickly do a calculation to save some time, but just probably explain the ideas and how we, create optimization structure objective, because those calculations take too long.
Yes.
Any question from the audience? Because, okay, no, it's good. We are doing, those calculations, we are a little bit too slow because a lot of voxels are being calculated. Okay.
Okay. So earlier I forgot to add in the clinical goal. Let me see if this one have it. Okay. So we are using Eclipse version 16.1. Then we have the option to add in clinical goal, which is nice. It's allow us to see we meet constraint all in one page instead of going through it individually on the DBH. So here I will normalize at least 100% prescription to 90% of the volume. Okay. Okay, so we're meeting all the goals here.
So this clinical goals actually you can download from Varian website for many disease site, or you can manually type in. Since we basically save a template, this is basically our doctors is using that. For example, PTV, 100% of volume should be covered by 95% of the dose. Yeah, and what's the constraint for different organ risk? You can save as a template, and every time you can run this clinical goals, you can see which objective have been met. If that's not, you can go to find out why. We can go back to optimization to fine tune it. Yeah.
Okay. And since we're meeting everything pretty well, let me try to increase this. Even at 99% PTV, we're still good on max dose, and min dose of PTV is also above 90%. And everything's meeting. We can evaluate the plan. So I already can tell I will, next thing is to tackle this 50% that is leaking out. Okay, the streaking outside of the 2 cm away from PTV. And turn off. The yellow line is the 100% of prescription. If we evaluate this one.
You can also see the dose, actually the hot spot 127%. This is quite normal for SBRT. We want actually like inhomogeneity of those dose. So it's not like regular IMRT or VMAT. Yeah.
Yeah, sometimes it's okay to go above 130, like around 140. It's fine. So the 100% is pretty conformal to the target. So from here, I'll treat it like a regular VMAT. What I can do next is convert the 50% line to a structure.
So TRAM is basically trying to reduce, trying to make 50% of those known even more conformal. Yeah. So TRAM actually, I have a suggestion for you to the planning. I think you can, there's a ring structure, right? Do you have, what's the ring structure? I forgot, but you can basically increase the priority. That is also one way to do it, but either one will be okay. Everyone have different experience. Yeah.
So yeah, since we're all okay on all OARs, it's okay to increase the priority as well. So 50% inside. Then from here, I'll go back to the optimization window to limit that streaking. Mm. I'll go back to level 3 to make the change. Maybe when this start again, I can go ahead and talk about the lung case while we're waiting. Okay.
Yeah, that'll be good.
Okay. So here I said, I don't want any 50%, so we'll reduce it by 100 centigrade. So here's similar, very similar case to the liver. Let me see if I put this in. I will have 3 ring structure to restrict dose outside of the PTV. Okay. Then again, we will have the PTV and the hot structure, which is the IGTV.
So you can see actually for SBRT, usually we have, especially for body side, lung or liver, you have ITV and the PTV. They are the most important. And when we talk about the brain, I think it's only have a GTV and PTV.
Okay, again, we didn't have any OARs as the objective because it's not near or overlapping any of the sensitive organs. So again, we have ring 1, 2, and 3, which restrict dose of the 90%, 50%, and the 25% of the prescription. Okay. Then I will have the priority of the ring around 50% of the target. And here's the result. We have this out. So we can see that the 100% is very conformal to our target and the 50% line as well. And then we are able to meet all of our constraint in this case. And our max dose is 116 and the min dose PTV is really good to 94.1%. I'll hop over to it's still calculating. Okay. Again, maybe I can change the normalization a bit since we're doing okay on our organs. Maybe 99. So even 100% of the dose covering 99% of the target, we're still passing all of our constraint. Any question?
So for this case, you can see the dose is 12 gray times 4. And it's also on the housing 6 triple F, or we all pretty much for every SBRT and SRS we use 6 triple F. Some place like for brain using the 10 triple F, but we prefer 6 triple F. Let's pros and cons. For this case, I believe also using 2 partial arcs. I think it's very, very important in terms of planning. Is make sure the its conformality is very, very important. Someone just asked the question about what's the metrics to evaluate for evaluation. For people who cannot register through Google Sheet, it looks like it's probably your issue over there. It looks like many other people can register through Google a spreadsheet. Okay. So this case, I think the planning is very similar. One actually a lot of one which pay attention that Tram, do you run the SBRT script to calculate R50? Can you go to tours? Can you go to tours?
What is it?
Scripting the tours. Yes.
group.
Yeah, there is, yes, SBRT planning index. Yes, that's right. Yes. You can see in this case, the R50 is about 5.4. This is quite interesting. The R50 means the volume of 50% of isodose line divided by PTB volume. Probably can be a little bit better, but in this case, we probably don't have much time to calculate to optimize it. It's quite, sometimes it's need to come. Okay. So questions that, can you share Excel with assistance? Yes, we will. Okay. Okay, so we are running out of the time. Any question for the lung, the liver side? This is also, okay, let's go back to liver, right?
Well, yeah, let me see how we do on the it's fine then. Please 100 to 95 or 96%. Let's try 95.
Yeah, for this case, the R50 is 3.3. I think that means it's quite conformal. It depends on the target size, I would say. So the conformality index 0.97, which is close to 1, which is very good. Yeah.
Mhm.
Can you see the R50? I mean, sorry, PTB plus 2 is the 50% of isodose line within the 2 cm. Yeah.
Yes, we reduce the
Right.
the leakage a lot.
So this is also for us to evaluate the SBRT. So we see conformality. Usually should be 1 between, about 1 or 1.1, which is good. Also, like see the dose on the hotspot, we usually is between like 120 to 130, 135. So in this way, create a dose gradient. Basically, in the GTV, the center of the target is hot. We like it. We like that.
So majority of our 115 is
Yeah.
inside our ITV. So okay.
Okay. I think I can give some demo for the brain. Well, probably will take at least 30 minutes to 45 minutes. Thank you very much. Let me see. I can share my screen. Okay. So the brain is different because for the brain, a radiosurgery or stereotactic, we use. Let me share my screen. Okay, you can see my screen, right? So
Yes.
I will give an example to using 2 different ways to create a plan. I also prepare several cases, but there's one is simple, one is complicated. But I will explain the concept. Okay, so the first case, I believe the target is in the central region. Actually, this is our approved clinical plan. Okay, so I'm going to copy this plan. I'm going to delete everything. So copy the plan. I'll get a demo. Okay. I'm going to delete all the beams so we can start from scratch. I'm also going to delete all the optimization objective. So you can see how I make the plan for this one. Again, the target is very small and the conformality is most important. Though the rapid dose fall off, and that needs some tricks. Okay, and for brain, we can do couch kicks. Does anyone know why we can do couch kicks for brain? Why we don't recommend? Why we don't recommend couch kicks for body, SBRT or like lung or liver? Okay, there's a reason for that, because for brain, you don't have the cleaning issues. It's much easier to, have the clearance. Okay, so for this case, we basically provide one fraction and 20 gray. Let me show you the target. Okay, so this is primary, the GTV. Can you see that? That's the target. Okay, this is the GTV. And in our clinic, we actually use 1 millimeter margin from GTV to PTV. Can you see that? That is basically the target in the central region. Okay. It doesn't matter. Okay. So what I'm going to do, again, there's two different ways to, if you have a hyperarc license, it's much easier. This one actually is needed to buy from Varian additional package, but I'm going to create a plan without, automation. So which similar method tram have been used. I'm going to create ring structures. Okay. For me, I'm going to let me go to the contouring. Okay. I'm going to create a 5-meter ring outside, then add additional 1 cm, then additional 2 cm. Okay. So my idea is I create 3 ring structures and make sure it's conformal. Okay. You will see that. Okay. So I have PTV. I'm going to create a ring structure. Let's see. So when you create a ring structure, you use external wall, right?
Yes.
Okay. So I'm going to, this is a quicker way. I have my way, but I'm not, by the way, I'm not a dosimetrist. So I want to create a 5-meter outer ring. So the out inner it will be 0, right? That's right?
Yes.
And it's 0.5. I'm going to create a new structure first, I guess. Okay. So I'm create control region. I'll say ring 5 millimeter. I gave a name so you can see it. Okay. Can you see that? I'm going to apply. Yeah. So this is a 5 millimeter ring structure. Oh. Okay. I'm going to create a lot of structure. It's additional 1 cm. Let's see. So 1 cm, that will be in total 1.5 cm. The inner wall will be minus 0.5. I cannot, that will be from PTV. I'm going to create a new structure. Okay. I call ring 1 cm. So that 1 cm basically is 1.5 cm from PTV, but it's additional 1 cm structure, okay? So yeah, if I turn off, yeah, and you see that? So the first one, I create 5 meter ring, then on a 5 meter ring, I create additional 1 cm. Okay, so I'm create the third ring structure will be additional 2 cm. So the total will be 3.5 cm and minus 1.5 cm. I'm going to create, I call it 2 cm ring structure. Let's see, I go back, okay. So basically what I'm doing is I create a additional 2 cm ring from the second ring. Okay. See here, this one. Okay. So right now I have three ring structures. I go back to planning. Again, different way have different different people have different experience. This is basically how we do. If you actually, excuse me, many of dosimetrists in our clinic do not use this way to create, but because we have automation, we have HyperArc, which is you don't need to create ring structure. But right now I give you some basics to how to optimize, how to plan radiosurgery case. Okay. Let me zoom it. So right now, I'm trying, you can see the G, let me turn it off. You have GTV, PTV. I create 3 rings. One is 5 meter ring. Okay. I also have 1 cm ring. I also have 2 cm ring. The goal to create this ring structure is I want to make sure the dose is really confined in this area. The reason I create 5 millimeter, additional 1 cm, and 2 cm, it is because I want to have the maximum dose do not pass through 5 millimeter. And 50% of the prescription dose do not go into the second ring, 1 cm. The 25% of the dose do not go to the third ring, which is 2 cm ring. Okay, so I have a purpose to do that. Okay, so that is the ring structure. So the beam, remember, this is quite important. So again, you want to avoid the collision. You also want to deliver efficient. Okay, so you can go to, I'm going to add beams, okay? I choose the edge machine. So some centers have a Halcyon, which does not have couch kicks. To be honest, your plan probably will not be as conformal if you use couch kicks. It's basically non-coplanar beam. I use the edge. I use the 6 triple F, the highest dose energy. The tolerance table, I use SRS brain, okay? So the first beam I'm going to use, by the way, the techniques always use SRS arc therapy because that will always change your dose calculation grid as 1 or 1.25 millimeter. So I'm going to, the first one, I'm going to use, let's say from 179 to 181, which is counterclockwise, okay? This is how I want to use the full arc first. Okay, the collimator angle, this case is really not that important, but I'm using probably 30 degree. But I can see the beam eye view because, okay, I'm good. Oh, beam eye view here. I need to turn off the ring structures. I probably can change a little bit the angle, the collimator angle. It really doesn't matter. Okay. I probably can change to 15 degree. Okay. If you go to 3D review, I want to turn external 3D view. Can you see? Oh. You can see this is basically full arc, right? The full arc actually when the couch is 0, okay? So now I want to rotate the couch to 45 degree. So sorry. Oh. Yeah. Okay. So now I want to actually rotate the couch to, I'm going to copy the beam. So this is very, very important, okay? So since I ready from 179 to 181, I don't want to rotate the gantry back. So I'm going to 181 to 0, which is 179 to, okay, 181 should be counterclockwise, okay? I'm going to rotate the couch 45 degree. Can you see that here? Okay. In this way, does not have any collision, okay? If I'm going to rotate the couch to 315, can anyone tell me the problem for this beam geometry? It will have collision, right? So I want to have my arcs always above at the isocenter. So this doesn't work, okay? So which means I'm going to rotate the couch. Okay, the first arcs is couch at 0. I rotate the gantry from 179 to 181. Okay, so the second beam, I'm going to rotate to 45 degree, which I believe is rotate on the left side. No, on the right side, the couch. So, but my gantry angle is going to 181 to 0, okay? Are you here with me? Let's see the question. Yes, okay, I got it. Okay. Lots on the shoulder is basically have like a collision problem, okay? So the third beam, okay, anyone guess what's the third beam? The third beam, I want to actually continue the gantry from 0 to, let's see, 179, okay? But I'm going to rotate the couch to 315. I think that's the case. Yeah. So again, the first beam is full arc, right? Couch at 0. The second beam is like a half arcs. See the gantry rotation direction, right? From 179 to 181. That's pretty much a full arc, right? The second beam, I'm going to rotate the gantry back from 181 to 0. Okay, but I'm going to rotate the couch to 45. The third beam, I'm going to rotate the couch to like 315, but the gantry continue rotate from 0 to 179. In this way, you can completely avoid collision. Okay, collimator angle, I'm trying to use different one. Okay, where's the collimator angle? I want to use them probably 30 and 345. Okay, that is pretty much the geometry I have here. Okay, I basically using, I can say this is like 2 full arcs, but it's one full arc plus 2 partial arcs. You can even add, couch at 90. You can do that. Okay. For example, okay, I'm going to copy the beam, paste the beam. Okay. Okay, the last one, let me see. I believe I can rotate the couch to 270. I think for this case, probably this 3 beam will be okay, 270. But I'm going to from 179 to 0. Let's see. No, that's wrong. Can you see that? You cannot do like this way. So it should be 90. Okay. Ideally, I want to have this beam to here. Anyway, you can see that you can add more beams. But this one in the delivery of the couch basically from here to here probably will take additional 1 or 2 minutes. Okay. But I think it will be okay. We can do like this way. It can be better, but okay. So we have basically 1 full arc plus 3 partial arcs. We're going to plan this case. Okay. Any questions so far? This is how I place the beam. It's very, very important to avoid collision. Okay. So you can see all the arcs is on the inferior side of the isocenter. If any of the beam, go to the shoulder outer place, you have a collision problem. Okay. So next step is going to place the objective. Okay. On this case, I believe the brainstem is also close to the target. Yeah. Let's see. Actually, not bad. It's close. Can you see that? There's only a few slides. Yeah. Can you see? So basically, I want to actually give objective for the brainstem. Okay. Can you see? Yeah. If you go to physician's prescription, so the brainstem, I believe the maximum dose is 12 gray. For this case, we probably can achieve lower. Say 0.5 cc less than 12 gray. That is, then the chiasm is quite far away, so it'll be okay. That is basically the objective. Okay. That's what's the question. The planning screen is too small. Does any other people have some problem? The planning screen is too small. I don't see that. I'm sharing my full screen. Any problem? It's fine now. Okay. So my next step is going to optimization. Okay. Canal range about 180 degrees. I got it. Okay. The arc 170 line. Okay, that's not extended, so I will make some changes. The geometry probably is 180. That should be okay. Yeah. Actually, let's say I can delete the number 4. It's okay. We have 3 arcs. Or more than enough. Okay. I'm going to planning objective. Okay, I'm going to delete. Actually, I'm going to delete some of the objective. This is from original plan. Okay, so I can see I have brainstem here, right? I can see the maximum dose. I can even see, 1150 gray. Okay, so can you see my PTV? My upper dose, the maximum dose, which is about 25%. I'm okay, go to 26 gray, which is about 30%. The prescription dose is 20 gray. I can give 40. So my lower objective is 99.8% covered by slightly above prescription dose. I can even go to higher. 100%, I want to cover the prescription dose. Okay. This is for me, how I make a plan. I want to also add a GTV structures. I want to have the lower objective. Okay, so for this case, I want to have 100% of those. I want to give, let's say, 22 gray, which is about 10% above. Okay, so apparently I want to have GTV a little bit harder, right? So my prescription dose is 20 gray. So I'm asking the optimizer to give like 100%, give even more, right? I want to give actually GTV, I want to hot, okay? Then I want also can add the upper objective. It doesn't matter actually, the GTV, because I have PTV objective, which is okay. Okay, so now I go to ring structure. Do you remember? I have 3 ring, 5-meter ring. Upper objective, I want to give 0% to prescription dose, okay? Because this is a 5-millimeter ring. I want to give 80 objective, okay? So 5-meter ring, I want have actually stay into 50%, no, actually 100% isodose line. Then I want to have 1 cm ring. I want to get 0%, 10 gray, 50% of isodose line, okay? That's 80. The next one, I want to have 2 cm ring. Is what? 25%. The dose, okay? 80. This is how I place the objective. The ring structures, okay? Again, the 5-meter ring, I want to have 0% of a dose, go to the prescription dose, 20 gray. On 1 cm ring, it's basically is 50% of the dose. Then 2 cm ring is 25% of the dose. Okay, that's pretty much, okay. For me, I want to use normal tissue objective. I can, try using the manual based on our experience. I want to make it simple. I'm lazy. I want to use automatic. Okay, I want to give even higher. Okay, let's say 100. This is basically normal tissue is also kind of like a conformality. Okay, someone asked about MU ratio. Okay, so for this kind of case, like single targets, I want to use actually, the MU to the dose, a factor of 2 to 3. So for example, in this case is 20 grade, 2000 centigrade. I want to have a ratio, MU ratio about 2 to 3. Let's say 2.5. I want to give 5,000 MU, so maximum MU, okay? It's not that critical for this kind of simple plan. The MU ratio, which is the number of MU divided by the centigrade, I want to give a 2.5, okay? So the setting is the fine structure is okay. And let's say I'm thinking to change it to faster because I want to save time, okay? But in real planning, don't do normal, okay? I just want to be faster to give you the idea, okay? When you do the planning, definitely not higher resolution because the target is so small. Okay, I will start. You will see it. Because we're running out of time. Because I also want to show you the hyperarc, how it works. Any question? I know there's a lot to cover today. It's a little slow, even though we have GPU, and I believe some others are also using. Okay. You can see the cost function here is okay. It's kind of, you know, I can turn off the ring structure in those. You can see this is probably the 5-meter ring here. Yeah, you can push actually everything go to within 50%. You already can see that those actually is quite conformal. Yeah, on the right side when you evaluate. Yeah. So that's the brainstem. Brainstem which looks okay. The ring structure is still pushing hard, 5-meter ring. Can you see that? The GTV, yeah. So this is about 22% of a hotspot. Again, my dose calculation is kind of like a 2.5 millimeter calculation grid because I want to be faster. Okay, but just give you the ideas. Okay. Again, we want to make a very conformal plan. And then you can see actually it is conformal. You can see, okay, actually right now, it's calculating the dose right now. Okay. So the red isodose line is basically 50% of the dose. You can see it's very conformal. I'm going to turn off. No, I cannot turn off right now. Okay. Have to wait until the calculation is complete. Yeah. So, within such a short time, we cannot make a perfect plan. Just give you the ideas and how to place the beam, how to create ring structure, and how to, place the optimization objective. That is pretty much, then you just need fine tuning by changing the objective, the volume, and the priority to make the plan your doctor wants. Okay, but we already talked about this is a third plan, and believe those calculations still using high resolution grid. Hopefully next 1 or 2 minutes. I cannot open the same patient with another method using HyperArc, but we'll see. Let's see any question. That's a very good question. Actually, I do have a case, but I don't have time to go through. And for the brain, to be honest, I would probably, it depends on the distance of the multiple mass, right? Multiple targets. And if they are close enough, I would say just using the one isocenter, okay? But if they are separated by like 8 or 10 cm, right? I would recommend using the 2 different ISO or group into different isocenter. The rule of thumb is that we don't want to have the target. So basically, when the targets are too far away, it's in 2 different isocenter, basically 2 different planes. Okay. There's a reason for that. It's basically in physics that's called off-axis isocentricity. When they're quite far off, right? You want to actually have the center of the target close to the isocenter. Yeah. But it's so slow, it looks like a problem many people are using Eclipse right now. That's the reason why. Okay. Hopefully. So here is basically the cost function. I think this makes sense. There's also clinical goal. Okay, I cannot open anything right now. It looks like it's freezing. I do want to show you the HyperArc, by the way. Let me see. Why is it so slow today? Okay. By the way, I'm not a dosimetrist. Probably a dosimetrist is doing a much better job than I am a physicist. I usually do not do the plan by myself. That's we're trying to explain to ideas how to make these plans. To make a good plan in the beginning, especially, it probably takes time. Okay. I don't think this plan is great plan, but it's not a bad plan. And also for this kind of case, many centers using CyberKnife or Gamma Knife to treat. In the US, here, in our center, we use actually NILAC to treat. Okay. So now it's level 4, should be very quick. I probably can change objective to even 2300. So actually it's a bit harder. Okay. I'm not sure whether it will change anything. PTV, I want to probably, oh, okay. So when we complete this plan, I will probably, show you how to evaluate the plan. Okay. This is just the first round of optimization, but I think it's business plan, okay? It's probably take another 2 or 3 minutes. The reason I mean, this case can probably use on the four beams, but that calculation probably even take longer. Let's see. In my first lecture, I did mention that the plan evaluation. See, on a hotspot, 125%, which is reasonable. Conformality, usually, 1.1, 1, ideally it should be about 1. Between 1.0 to 1.2 would be good. The conformality basically is the volume of the prescription isodose line divided by PTV volume, okay? R50 is really depends on the volume of the PTV volume, usually less than 4, but its volume quite big. This number can be big, which is basically is 50% of isodose line, the volume divided by PTV. There's also gradient measurement. I will show you actually the distance between the equivalent radius of 100% isodose line to 50, which this number is smaller, which means it's better, the plan, okay? It's about, for this case, probably I can get 0.4 cm, which means the 50% of isodose line to 1% isodose line, about 4 millimeter, okay? That is basically how we evaluate the plan, okay? So yeah, in the first time I gave lecture about, we treated 46 brain mets in one plan. You can see that here, yeah. Okay, so let's see how much we have calculated. Oh, that's very slow today. You can see beam geometry, right? We have, because this case is like so many mets using one isocenter, 1 full arc, 3 partial arcs. Again, when you solve this geometry, make sure that does not have any collision, and the arcs basically is above of the isocenter. We made this plan actually. We see here actually the objective probably the normal tissue objective probably I can increase to 120, which can make even more conformal. But okay, almost done. Again, this is not a perfect plan because I changed the calculation, the structure size 2.5 millimeter, which is, I was thinking that I can make it faster, but actually did not. Okay. I probably will stop here. We do have a clinic plan I can show you. Okay. Any question here? How much was the total interval dose? I don't know. I can find out. But to be honest, this kid could be treated with whole brain. but our doctor like to treat radiosurgery. And we can use the hyperarc, but it will be very complicated to use the way actually I'm showing. So after complete this calculation, I will show you a different way to make a plan, which is much easier to make. Okay, almost done. Other place probably is faster. We probably, I don't know, we should be faster in this case. I don't know, Tran, are you still here? Okay.
Yes, I'm still here.
Yeah, calculation is so slow, right?
Yes, yeah. Some days like that.
Okay, we need to figure out. Okay, I like to use color wash. Okay, I can see let's say 100%. Can see the GTV, right? Let's see, the PTV turn on. Yeah, right? It's very conformal. Okay, so definitely, let's see, if I go to 110, I'm pretty much in the GTV region, right? If I go to 50%, now pretty much, in the range here, right? Yeah, 50% in this 5-minute range. Okay. Yeah. If I go to 25%, it's quite conformal, I would say. You can probably work a bit more. You can also go to DVH. You can, let's say, turn on the conformality, probably you call them. I want actual conformality and the gradient measure here. So my PTV conformality, actually that's really bad, 1.47. Likely is that I did not use the high resolution calculation. Okay. Why is like that? Let's see. So we definitely can push that. This one is conformality is bad. The gradient measure important for which is very good. Okay. So I don't think I have time to to fix that. I'm going to use a different way to calculate to create a plan. So in this way, it's much easier plan. Okay. So I'm going to insert hyperarc. Can you see that? Oh, why I cannot do anything? Hey, Tran, why I cannot insert a plan?
You want to insert?
The hyperarc plan.
Okay. Let me see. Can you pull in the structure set?
Oh, I see. Because we already have a plan.
Yeah.
Oh no, still cannot.
HyperArc. Oh, insert. Go to insert.
Oh, insert. Oh, okay. HyperArc plan. I got it. Okay. See, you can see new HyperArc plan. I want to have a new course. Okay. That's okay. The dose. Oh, this is very easy. Okay. Go to next. So you want to select the target. I want to set PTV. I want to have a new reference point, doesn't matter. I give it those, reference those. It's one fraction. Okay, go to next. Select the machine, the dose rate, which is, select SRS technique. It's automatically help you to select that, right? Okay, so after you select target structure, we'll have GTV and PTV. Yeah, can you see that? It'll automatically help you to place the arcs. Yeah, you can uncheck it. Then you can check it. This is basically the fixed geometry. You can also do a dry run. This is basically dry run to check the whether it's some kind of yeah, this is dry run to check the how it works, the delivery. This is kind of the first beam is full arc, right? Now see, rotate the couch to 315. This to give you an idea how it's delivered, right? Yeah. Now to 0. Okay. See, now you are going to rotate the couch to the other direction, then gantry will continue. That's pretty much similar way I just created the manual plan, right? Okay. Now rotate the couch to 90, then do another half arc, right? Anyway, that is basically the idea. You can see the beam. Okay. Now next step, just go to optimization. Okay. Super easy. You don't have to create any ring structure. Let's see what's the question. Okay. No. Okay. You can see here, optimization have only 2 objectives, which is okay. You can, put like brainstem, right? Once it's conformal, I think it will be okay. So the brainstem, I still want to actually add alpha objective 0 to 12 gray. I want to give 80%, 80. Okay, that's it. You can start into optimization, okay? So you can probably achieve a comparable, even better plan, because last time I really, my conformality index is bad. Likely probably I messed up in the grid size, like 2.5 millimeter, which actually make a big difference. Yeah. Okay. So that's it. That's hype arc is very easy to make this kind of plan for the brain SRS. We are running out of time, and this is our last training session. And I hope you learned something about SBRT and radiosurgery. And if you have any question in the future, feel free to reach out to us and try my best to, get back to you. Sometimes may not so quickly. That's basically how we make plans. And yeah. I know this optimization will take another 10 or 15 or 20 minutes because of somehow our Eclipse is not very fast. Yeah. So the hyper arc, the good thing for hyper arc is, let's see, you can see the dose, probably some point. This is okay. I don't want. If you think about the dose percentage. Yeah. This is pretty much, you can see that's those line, right? Yeah. Okay, I think we have to already 10 minutes over. Let me know if you have any question. This is basically give some idea of how we make plans. And thank you very much for joining the training session. And if you finish all 6 training sessions, basically Geneva will go into contact you, send you the certificate. But you need to complete a post-training survey for us to understand how useful this training session. And so in the future, we can continue to improve, okay? Yeah. You can see in this plan, actually, it's probably a bit hot, but overall, it'll be good, yeah. Okay, I will wait for a few minutes. You can feel free to, actually, I'm going to stop the recording, okay?